Good morning still, though we are running a little late. And do you want to start with a brief round of introductions for everyone, since we have big diagnostic giants and people who have done really well in the healthcare industry, who have actually made a difference with their product, if I may say, and every one of them, they're very accomplished, and all of them are trying to do something different from the traditional route of view. So I'll say I am very happy and lucky enough to talk about health tech in a different perspective with each one of them. So very short, within less than a minute, just a round of introduction for each one of you.
Hi, very good morning to all of you. I'm Dr. Shelly Mahajan. I'm a pathologist and I'm the lab director at Mahajan Imaging and Labs. Looking forward to a great discussion today.
Hi, I'm Dr. Shikha Sharma, and I'm a medical doctor by training. I founded the Integrated Preventive Healthcare platform, which is basically using food as medicine. I'm very happy to be here and for the discussion.
Thank you, Saarthak, and thank you, Business World, for giving me this opportunity. I'm Dr. Arjun Dang. I am a fellow in GI and liver histopathology and a pathologist by training. Currently, I'm the CEO of Dr. Dang's lab.
Yeah, hi. Thanks for having me here. This is Deepak Sahni, founder of Healthians, which is the online diagnostic chain. And I've done multiple ventures. This is the third one that I'm into. Thanks for having me here.
Thank you everyone for the introduction. So as the topic goes, health tech. For every one of us, health tech is only a software. Is it only taking our raw data, instead of filling it in pen and paper, we are putting it in a software? Is that the tech component? Is there something more to that all of us can aspire to? Is it purely HIS, EMRs, or in this today's data-driven and tech world, is it WhatsApp-based automation for patient clinical outcomes? Is it, what can the real health tech be, according to each one of you?
So, health tech, especially in Indian context, I think any technology which is there to reinforce the existing healthcare infrastructure, existing healthcare services in the country, I think that is health tech. Health tech is definitely not there to replace anything. I mean, the core essence of healthcare is human touch and empathy, which cannot and should not be replaced. It is going to be sustainable only if it is there to reinforce what's there, today. It's very important to understand and work on the on-ground realities for any kind of technology to be successful and sustainable in clinical practice. So I think for me, health tech is anything which focuses on removing the inefficiencies and improving maybe turnaround times, diagnostic accuracies, and reinforcing decision-making tools for clinicians.
Really, what I look at health tech is what a mobile phone is to communication and what flights and airplanes are to travel. So health tech is to assist us. And I think there is no doubt about what health tech can do for us, for everybody as humanity. The whole thing is about how do we adopt health tech, how do we use health tech. And that is the most important thing, which I think for all of us here is to understand that how do we use this tool to improve our performance or to do many other things which we want to.
Thank you, very, very thoughtful comments. But just to break it down very simply, and I had this idea right now because I was discussing with Deepak about his new restaurant. And how I look at health tech is, of course, operational efficiency and patient impact. But just for you to understand and to kind of make it very, very simple, it's like how on a food table or a dinner table, you have some condiments, right? Like you have some achars and some mirchi and some pyaz on the side. So that's adding value. That is adding impact to the overall experience and, of course, to the patient. The second thing is operational efficiency, and that's what health tech can do. So I just made like a little diagram here of something that I saw in my visit to Korea. This is basically a combination of a spoon and a fork. So it basically makes it easy for anyone eating anything to
It's
use
called a
just one
spork.
cutlery. Yeah, so it's spoon and fork mixture, that's called a spork. And of course that adds any kind of efficiency as well. So I think efficiency and impact doesn't mean you eat more achar after lunch, but I'm just saying.
Yeah, I think it's already made a lot of spice to this, adding achar. But I think yes, health tech for me largely is a huge enabler. I think it's a looking at India as an entire healthcare system of India where efficiency is required. We do have very less beds per person. And to scale the entire system, you need some layer. And I think the tech enables that layer to really reach to that scale. And without tech, it is very, very difficult. Also, reach, accessibility is very, very high through tech. But all in all, that tech is just an enabler to really, really deliver healthcare. And it cannot be any replacements to any healthcare needs. And definitely with the entire tech layer coming to any of those, like we just spoke in the last session also, it's just enabling the entire scale of it, the cost efficiencies of it, and obviously it's removing the frictions out there, and that's what the tech is doing largely. And there are more health tech, which is just the tech. I would say it's noise than anything else.
Okay, so good. Thank you, Deepak, for just clarifying between the noise that you're thinking what healthcare, health tech is. So let me just further clarify on the fact that each of you run your organization. From a tech perspective, apart from the HIS or the EMR or a software that you're using, and every one of you has said that you're using tech as a growth enabler or as something to drive efficiencies which were not being driven. What would be an example of a tech that you have done or installed or using or planning in a way? Any technology that is disruptive and something that you would want someone who's hiring any entrepreneur to work on that technology or something of that in a similar way. What is that thing that you want to disrupt in your personal ventures that you're running?
Honestly, I think when it comes to healthcare, any tech cannot be disruptive. Disruption is essentially replacement. But like I said, in healthcare, technology can be an enabler for it to be sustainable. Because healthcare at its core, relies on human touch or human, judgment. And it's just so complex, the entire ecosystem with public and private players, with small labs, small hospitals, big hospitals, public healthcare systems, regulations. So it's all so complex that a technology cannot replace human judgment.
So just
That
to clarify that our purpose is not that the tech replaces. For example, can we do digital OPDs instead of the physical timing from a 9 to 6? How do we enable that? Or we have a lot of diagnostics players there. That how do we extend the home collection sample network without a phlebotomist being able to take the sample?
Absolutely. So that's what I was coming to. That said, to enable that growth and to enable those processes to be more efficient, I think in my kind of setup, I would like something like an Uber for phlebotomists or riders, where the phlebo just picks up a call thinking, okay, I am nearest to this place. So B, from all the administrative point of view, all the billings, reimbursements from government agencies and other creditors. So all of that requires so much manual work, and it does not really require a lot of human judgment. So I think those processes can be automated to the T to make it more efficient and less stressful for the administration and management, so that brain space and time space can be utilized in improving the patient care and patient services upfront.
And I think an Uber for Flebo did exist, bookmytest.com, something of that sort, that you can order. Deepak,
Question
were
is,
you
why
working
are
on
those
that?
not sustainable still?
No,
So I
yeah,
think
that-
Deepak would be the best person.
Yeah, I think, yeah, so lot of, so you asked about disruptions. I think we've done multiple through
Yeah.
tech. There is still a lot of to be done. So I think largely if you look at, like I said, cost efficiencies, logistic is the biggest disruption we did. So all of you, what you're talking about, Flebo and everything is logistic. It's not just one end, but managing around 2,500 people daily, picking in around 15,000 samples with 0 people in the back end, right? Everything is tech enabled. So you know where to go, how to reach, how to faster reach. The sample is getting delayed, the temperature is changing. So every moment is automatically calculated and it understands where to go next, right? So the idea is that the same person should be able to visit more and more houses in the minimum time. At the same time, reach back to the lab in the minimum time, depending upon when he picked the first sample. So it's all automated. So, and similarly in the cost efficiency side or a trust side, so there is a lot of transparency that the entire system required, right? So you don't know this report which is in your hand, is it really being genuine or not, right? So linking it back to the machine data, having a QR code here, you scan the QR code, you know which machine, which data, was the machine calibrated, and who did the test, who signed it, right? So nobody can just fake the report and just give it to your hand because you have the original validation. And that used to happen a lot. So a tech is enabling the whole transparency angle to also it, to the same thing. Third is understanding your own health data. Also is a lot of insight that the people have on him. Every person is different. And usually till we sorted that out, we knew the doctor was seeing the current report and giving you medications, right? And you were not carrying all that reports and everything else. Today, the same doctor looks at 5-year data, 10-year data before deciding what medication has to be given, right? So tech has enabled, given in the clinicians the sort of choice to go into the data and obviously give a better medicine or look at a different sort of a thing. And that is why the prescriptions are not just medicines now. It is also about lifestyle changes a lot and all, because you are just seeing the trend of the people.
Personalized
so
medicine, you're right.
So it's becoming that way. So these are all the disruptions that we have already seen. There are more coming, right? So I think we are far away from a non-Flebo taking a blood sample, but we are thinking of what if we can't, without a blood sample, we can do anything, right? So yeah, so like I'm wearing a patch here, so I know exactly what's happening in. So there is more and more such devices coming in where you can track everything out there. So now HbA1c without even a prick is possible, right?
Arjun, your tech in Dang Labs.
So again, completely agree with Shelly and of course Deepak also, and the amazing disruptions that are happening. And of course, I mean, it's all of us to kind of work together to increase efficiency and impact. But you know, being from a family of doctors, from the time my dadu was an MBBS physician in the times of the partition times, and then of course my parents being a pathologist and a microbiologist, one thing that always used to trouble me, and I'm sure everyone in this room has been a part of that, is that today anyone in India, let's look at our country, walks into a lab and selects a package based on 2 things. One is that, what is my budget? Do I want to send 500, 2000 or 4000? And second is, अच्छा एक ब्लड शुगर का टेस्ट कर देना. एक्चुअली ना मेरी नानी को डायबिटीज़ था यार, एक ना लिवर वाला कर देना, मैं ना बियर ज़्यादा पी लेता हूँ वीकेंड पे. Someone else might say something, someone might have seen a thyroid ad, and you do these one size fits all cookie cutter kind of standard silver, gold, platinum, ruby, sapphire, these kind of packages. Now these packages are very, very standardized. They are not at all customized, not at all personalized to the person who's taking that right. So I mean, what me and my team of doctors set out to do, and it took us about 3 years to build this, it's a free of cost website that anyone can log on to. It's called discoverbydrdanks.com. It's a few minutes quiz that you take, and that helps you understand what is the correct test for you. And no CFO of any company would agree that you should have such a free tool. But it was our initiative to guide the industry into saying that yaar, healthcare has to be personalized. It cannot be one size fits all. So Discover basically, once you log in, asks you a few questions. Also, most importantly, whenever someone's doing a test, there has to be a health goal, right? Because now we are moving towards all this testing that's not for illness, it's for wellness. So for example, just hypothetically, If we are 5 people who are, say, 30 years of age, and today if we go into a lab to do a particular test, we might all have different health goals. Like, for example, Deepak might want to do fitness-based testing, right? I might want to do hair loss and hair thinning, whereas Saarthak might be looking at something like fitness or maybe weight loss. Shelly might want to improve on her sleep because her stress levels are very high. And maybe Shikha ma'am has some other issue, like maybe she just wants to do well-being and longevity. So the tests for all of us, apart from our health goals, also has to be personalized to our family history. So the AI in that algorithm also prompts you with that. It also asks you about any current complaints, and most importantly, the reports of your previous medical tests, that longitudinal data is picked up, and any aberrations or any tests in that need to be repeated are of course also flagged. So at the end of this quiz, you get a curated list of tests. Along with every test, there's a peer-reviewed publication that also tells you if you're vegetarian, and if my module is telling you that do a B12 test, then it's actually proven by scientific literature why vegetarian males in India between the age of 30 to 40 should do a B12 if they're not consuming non-vegetarian food. So I mean, not disruption again, but like Shelly said, it's more enabling, it's more empowering the patient to actually measure what matters.
Okay, Shikha, your last and final thoughts on disruption in the wellness industry, or any other industry that you're working on these days?
So I love disruption.
Yeah.
So let me put a disclaimer out there. Disruption is really important. It is important because that's the truth of life. To begin, I'll give you my own personal example. So I started my journey by starting out as a medical doctor. Realized that medicine has certain boundaries within which the patient, you can give medication, you can take them out of the emergency, but after that, as doctors, we were not taught lifestyle medicine. So I moved out of tertiary care into lifestyle medicine. So that was the first change I did. In lifestyle medicine, I realized standardizations were a problem. So I started building standardized protocols. So like in my times, I don't know how it is now, doctors would write a prescription. The prescription would go to the patient. The doctor had no clue what the person has written. There was no data analytics. So what we did in good old days, we used to put a carbon copy. And we used to have a copy of every prescription we gave out and do analysis on Saturdays. So Saturdays we used to just do analysis of what we did, what was the impact. Now obviously after a point of time, we just had these many carbon copies, and the next logical thought was put it in a computer. Nobody was even willing to build a software for us, so we had to figure out what software to build. That was the first thing we did, to do data analysis, starting with carbon copies and cards, and then weekends just doing an internal discussion. That helped us to identify trends. When we identified trends, we figured that the whole calorie concept is non-scientific. And it was a big thing because everybody has been taught, and they have like a parrot, they have like mugged up that calorie is the concept. But nobody went deep into it, that why is it so unscientific, why doesn't it work? So we started looking for solutions. The solution we found was in integrating traditional sciences, where there was a lot of science, but unacknowledged science, because nobody read the data, nobody read the research. And there is enough research, by the way. There are 55,000 papers published on Ayurvedic research. So we picked up that and started marrying modern nutrition, modern medicine, standards into traditional systems. The next step was, we used to ask the patient, come and meet us, because today if I give you a diet plan, you'll be very happy. After a week, nobody follows it. So what we figured is we have to build psychology into it. We have to build nudges into it. And the compliance monitoring protocol was picked up from a Stanford review on how to change health behavior. That we put into a software where every data point was logged in, and we started noticing the patterns and the trends. Once we did that, Airtel had come in. So the next disruption was we set up a health call center. At that time, when we set up our first health call center in 2007, telemedicine was illegal. So that's the fascinating part of how regulation comes in later. And the COVID actually made telemedicine legal. Otherwise, we were, in a way, illegal. But we were doing telemedicine. We were doing consultations, remote consultations, because our patients were from Delhi and Dehradun and California. We had patients all over. The next step, what we are, I would say, struggling with is how to put AI into our systems. Because a lot of people think AI is giving solutions to patients, but the reality is AI is giving you information. And how you use that information is up to you. So I think disruption is a reality, it's the truth. And to cut a long story short, the reason India was conquered was because it did not follow technology. And we were still on horses and swords when the West came with guns and gunpowder. So I think today, if you see Facebook, Instagram, Google, LinkedIn, Uber, everything has come from the West. So it's high time we build our own systems to protect our data and also to think uniquely Indian, which is different than a lot of ways how we think. Sorry, it was a long kind of a story.
No, but I'll pick up from where you left, that health tech has always been challenging in India, and the reason why does health tech fail? I mean, is it because all of you are doctors, Shelly, except me and Deepak? So, is it because in MBBS, MD, you've already always filled papers, you've always filled reports? It's not that the day that you start seeing patients, you are only writing prescriptions rather than using a software, or everything is always done in a paperback way? Is it that nurses have been used to similarly write over there, or the systems don't speak to each other? The pharmacy does not speak to the HIS, and the other systems are completely ad hoc in between them. Is it an inherent Indian problem that we shy away from, adopting technology? Where do you see that? Why does health tech constantly fail?
So, so I will, till today, if you see, there are many patients who come to our centers who have like 3 bags full of papers from past 5 years, including prescriptions and some test which was done in some lab, the same test done in another lab, etc., etc., etc. So I think that is the one basic problem which is there. Why we are failing in adopting healthcare is not because of any lack in the technology or because of the cost. I totally disagree when people say that health tech is costly, that's why it's not being adopted. It's not because of that. It's, I think, because we don't understand the reason why a health tech should be employed. We need to understand the problem and then solve it. So for example, if this patient I'm talking about, who is chronically ill, is taking care of multiple people in the family and is taking care of all their medical data, medical documents, if I give that patient a solution wherein I can integrate all that information into one link maybe, the patient will not mind paying for that, because there I am solving some problem. So similarly, if you talk about a clinician, there is another mindset which is, I believe, a myth, that clinicians don't like technology, especially experienced clinicians don't like technology or they resist technology. I disagree. Clinicians or doctors love technology, but it has to be a good technology. The technology should not be something which is only, increasing the number of clicks or increasing another dashboard or another screen for the doctor. The technology has to answer some question or some problem. Be it improving the efficiency, reducing the cognitive workload on the doctor, or improving patient waiting time, improving turnaround times, improving diagnostic accuracy, or reducing the back-end work. It can be anything, but it has to solve some problem which is genuinely there in our healthcare setup, cannot be straight away adopted from a Western, healthcare setting. It has to be something which is customized to our needs. That's when the adoption will improve. Thirdly, I would say the implementation management. Any change being adopted in any kind of setting faces some resistance unless there is a proper implementation plan, training, integration into the existing workflow. It has to align with the thought process of the doctor or technician or administrators who are currently working on ground. So it has to align with the on ground realities also. So that transition period of implementation and training and workflow integration, that is also very important. So I think the actual failure or actual adoption issue happens at the intersection of people and processes. We are unable to integrate that together, and once that happens, any technology is most welcome as long as it improves the workload on any human.
So I'll pick up from there, but I'll take a different spin to this. So I have tried to push technology and the usage of softwares in my company, and I'll tell you my own insight. My own insight is at the top leadership. When you are bringing technology into your company, you have a choice to see your people either as employees or as customers. Now I'll tell you the difference. If you take a software which is not fun to a customer, they will reject it, and the team has to rebuild the whole thing. The user interfaces have to be rebuilt. Intuitiveness has to be rebuilt. But when a tech company goes to the top boss of a big company or a health company, they give you a horrendous software, sorry for using that word, which has layers and layers and filling and data and filling, and they don't realize that the person who's going to do all this is going to get so bored that they will after a point not do it. So I think if technology is not fun, if we don't look at our users as customers, the adoption is going to be pathetic, and that's exactly what happened in my first try of bringing technology in, and I forced, gave incentives, did whatever I could. It just didn't work. Finally, I figured if technology is not fun, it's going to not be used at all. So it cannot be a chore for whoever is using technology.
So I think very, very relevant and interesting points, and of course adding to what Dr. Shelly and ma'am also just said. So I'll take a use case of something that we are doing in Alzheimer's and how we kind of brought tech in it and how it's so much fun now and also increasing adoption. Is that so for all of you to understand, Alzheimer's is the most common cause of dementia in the country. About 70% of people who have dementia, like you would have seen, elderly people have loss of memory, loss of executive function, and all of that. And a lot of these cases are Alzheimer's. Now, what happens in a neurologist's office is that once you go there, they make you fill up some forms that is called as an MMSE or a MOCA assessment. That's a Montreal Cognitive Assessment. And they are just like forms and forms that that elderly person has to keep filling, or their guardian sits with them, takes about half an hour. So when we were starting this very cutting edge Alzheimer's testing, we actually huddled together and figured out a way to solve this problem for the neurologists and also the patients who are going there. Instead of sitting and filling up those boring and long forms, why don't we actually integrate it with a very fun game that all of you, all of the people who are taking this can play on their phone. So this is basically called a brain age test that we provide. It's a 15 to 20 minute very cool game, जैसे आप बचपन में वो snake खेलते थे हम सब. It's something like that where you have to join some dots and identify some colors and repeat some numbers. And I think that's one thing, unfortunately, all of us love is staring into our phone screen, although it's not advisable. But for this particular neurological assessment, our brain age test has seen a huge uptick because number one, like what Dr. Shelly and ma'am was saying, that it helps the neurologist with more impact, that is a higher uptick with patients, and also reduces their workload. And secondly, unfortunately, the patients love staring at their screen and they get this done in no time. So I think this is a very cool way of gamifying health tech in healthcare to help the doctor and also have more impact on the patient. And like what I always tell my team is that actually introducing health tech in a healthcare company is like changing the wheel of a moving car. So unless the entire team doesn't actually understand the impact that that healthcare will get, I mean, and then works like a team to actually take it to the finish line, it's always an uphill challenge. Thank you.
Sure. I think, yeah, I'll take a different view, specifically because most of this is the internal tech that we use. But a health tech is much beyond internal softwares, and there is a lot of consumer perception to the tech. Largely, I would say any health tech platform, because I'm seeing a lot these days, backing few of them, largely fails at multiple things. First and foremost is that a lot of health tech today does not really bothers about outcomes and trust, right? Anything that you're using in a healthcare sort of a setting has to really have the great outcomes. Why are you building that tech in the first place? It has to improve the outcomes, right? For the doctor, for the patients, or for anybody else. At the same time, it has to build that trust. So trust is required both ways. A doctor using a health tech has to trust on that health tech. A patient using a health tech also has to trust on that this is correct. Because sometimes you don't see a doctor, but you are using a technology. So a lot of people build it without both of these things. First failure. The second is a health tech also has to solve one of the biggest problem in health, which is the friction and errors. There's a lot of friction, like he just spoke about one of the frictions of filling 20 forms, right? Until unless your tech is solving a friction, or it is helping you to reduce the errors, it does not stand, right? So ultimately your tech has to really solve for at least one of these things or other errors. Third thing, why people use technology largely today is obviously cost is one of the factors. In a long term, if your tech is not reducing the cost, right? And we just saw the first session on the profitability and everything else. Ultimately, the tech has to solve for a cost as well. And it does, right? If you are building a right tech, it should solve for a cost in the long term, if not in the short term. And if all of these elements have been seen into an element, right? So people come to me, which health tech would you fund, right? And I always say that this has to be at least the biggest tick marks first. Because if you're building something, and I see fascinating products, but I don't see a use case of any outcome. I see fascinating products, but it doesn't solve for any friction. Because actually it doesn't create any friction. The guy is already doing it. He doesn't need that tech. So a lot has been there as a noise, which I've spoke about, but a genuine tech has to solve for really the trust issues, the outcome issues, the friction issues, the error issues, the cost issues, and then finally built in. I think that's a successful tech that can be built.
Thank you. So we'll now just take one very short answers, and Arjun, I'd like you to go first. That in the next 5 years, where do you see any Indian health tech or a company or someone doing something different? Or where do you want the next 5 years to be? You know, could be, I mean, AI in pathology or diagnostics, it could be remote patient monitoring, it could be homes as hospitals itself, you know, with pollution in Delhi, it could be anything. But for you, there was one short line answers from all of you.
So, hoping against hope, maybe not 5 years, but maybe 15 years from now, all of us are going to be out of a job. Unfortunately, ladies and gentlemen, let me break it to you. My vision today actually tells me, like the CGM that Deepak was referring to, or the sensors that are there now that actually bring the lab inside our favorite device, our phone, is going to replace my lab and replace everyone I have there. So I'm hoping that doesn't happen. But the way things are progressing with point of care testing, with sensing now the new term for testing, and with so many sensors, I mean, that place is moving very rapidly. Of course, high-end testing would need specialist and esoteric teams to handle, but I just feel that the same CGM that is actually looking at your blood sugar values right now is going to get integrated in that ecosystem where, suppose your blood sugar is high, it's automatically going to send that particular result to an AI that's being monitored by a physician who's going to order, say, a creatinine or any kidney function test. The same sensor is also going to manage that, and then based on the threshold of the values that they get, and in case you need any emergency help, an ambulance is going to be rushed to your house, maybe an ambulance or a drone, we don't know. So hoping against hope, but I really feel that we are moving towards point of care testing very rapidly.
Dr. Shikha?
Very hard question. You know, till COVID, I used to make these projections. After COVID, I've stopped making any projections. But what I can tell you is, and I'm going to go really off now. At the time of COVID, I did a lot of reading. So this is the Rahu Kal. Rahu is breaking all barriers, creating disruptions, media, technology, and illusions. So I don't know where the whole thing will lead. But yes, one thing which I'm definitely sure, humans stay the same. Autonomy, connection. These things, as humans, we are the same. We want autonomy, we want connection, and we want efficiency. So I can only guess where the rest of the world will go.
I think with health tech, I'm quite sure that within the next 5 years, and in fact, I'm hoping that the access gap between the various populations and all the stakeholders of the healthcare ecosystem, that access gap will be almost nil. I think the kind of health, for good healthcare, I don't think people will need to travel. Like today, now we are talking about ambulance in 5 minutes. So I think the high-end specialist healthcare will be much easily available to people. And I mean, you know, that definitely includes the point of care diagnostics that Arjun was mentioning, and the ambulance services, cardiac care services. I think that would be, that should have happened now, but I think in the next 5 years, that will be the, you know, main change that we should see with health tech adoption.
Deepak, your view.
Sure. So I think next 5 years, rather I would say I would wish India to be there. I think if you really see, there is a lot of AI in the worldwide being meant and built abroad. That's what we were talking about. But if you really think something special can be created, it can only be created in India, depending upon, because the population size is so big. At the same time, you have rarest of the rarest cases. At the same time, every doctor is seeing so many patients. So the kind of a data that we are sitting at is the immense sort of a data that India has today. I wish India would probably create one of the best AI on tech, because it has the data. A lot has been getting digitized, and a lot will come as digitized. And then we have the variant population, different size, different genes, different sort of foods, and everything else. The world can learn from us in terms of AI on tech, because we have that kind of a data potential that we can create and give it to the world.
Thank you. So if one line from each of you for the Indian health tech ecosystem or the entrepreneur, what would that one line be to either motivate or give clarity? Let's start from you, Deepak.
So I think from my angle, if you really see, if health is not solving the, health tech is not solving the problem, like it's just an innovation, it's not a disruption. So it has to really integrate and solve that problem.
So health tech in terms of, it has to have a measurable outcome, and only then it's a solution.
So I think only 3 words to the health tech community in India is 4 words, eye on the ball. Because I think we have to keep up with every different direction that the knowledge base in the West is taking us. We have to have a very, very keen understanding and a ear to the ground to see which wave, which direction the tide is moving. And then, of course, try and keep up. And like what Deepak was saying, I mean, India to be really there when the ball spins and it's time for us to hit it off the middle of the bat.
Shikha? Yeah.
So actually, I will take Deepak's words and kind of...
Deepak, you have said the trend rolling over here.
Yeah. So I just cooked them up because he's Deepak.
Yeah.
So India has the best doctors, which is D. It has the best diversity, which is D. It has the best data in terms of the volume of data. And
you're seriously going to thank your parents to name you Deepak today. I think so.
And we have tanks. So I think India should be the leader in disruption.
Okay, so D's, thank you. Disruption, data, and Dang and Deepaks are there. I know, but doctors. Okay, so doctors. So Shelly, your final thoughts, one line.
So I think healthcare depends on 3 main things: clinical outcomes, operational efficiency, and financial sustainability. All 3 have to go together. So for any health tech, think about clinical outcomes first. If that and operational efficiency are on our side, financial sustainability will eventually come. So yeah, I think we are in very exciting era of adoption of health tech, and I hope that I'm sure that we will disrupt the healthcare soon.
We have already disrupted. It's about how do we disrupt more. So thank you everyone for listening patiently. I'm not sure do we have any times only Q&A or that's up. So I would like to give a heartful thanks to all my panelists over here.
Final D of Dhanyavad.
Yeah, that's it. So thanks to Deepak, Arjun, Dr. Shikha, Dr. Shelly and all of them. And hope this session was insightful for you so that any of you is thinking any new perspective from a health tech, or any of you wants to reach up to these great mentors for advice for starting something new, I think they're the best people who can help you figure out the market, the strategy, and probably the execution part of it. So thank you everyone, and it's a pleasure.